And we're back on this Saturday morning, Sports Medicine Weekly. Steve Kashul and Dr. Brian Cole. Time now for our Ask the Doctor segment. This gives our listeners the opportunity to have Dr. Cole address their specific sports injury issues. It's very easy to submit a question. Go to our website, sportsmedicineweekly.com. On the homepage, you're going to find the link underneath the photo of Dr. Cole and yours truly, and just click on that link and you can submit your question. Got a good one here from one of our listeners, Dr. Cole. And here's what this person writes. Dr. Cole, I had shoulder surgery a year ago and was doing great in rehab, although when my fitness center closed down due to COVID, my shoulder exercise program became greatly reduced. Now my fitness center is open again, although during my overhead weight training, I feel multiple pops in my shoulder, almost as though the bones in my shoulder are literally trying to find their way back. There's no pain, but is this normal, Dr. Cole, and will it help to continue these exercises?
I would say that the first thing is non-painful popping is generally not anything that's significant, but I do see it in shoulders that are weaker. So for this listener who's asking this question, I would argue that strengthening is more important than ever because it's probably just the mechanics, the shoulder blade or the scapula, which has nearly 20 muscles attached to it, are weak. So getting into a strengthening program is more critical than ever. The popping is not dangerous. It doesn't mean you're going to make something worse by letting that popping continue, but it's uncomfortable, it's a nuisance, and in my experience that stuff can get better with resumption of a good quality strengthening program involving bands, external rotation strengthening with the arm at the side. Cables and bands are probably the mainstay of rotator cuff strengthening, as well as scapula strengthening. That's the shoulder blade, where you use a physio ball and various scapular Ys and Ts and things like that. All of those things can be looked up online as well. If someone's getting into a home exercise program, I would look for a scapular strengthening program or a shoulder blade strengthening program, in addition to the obvious, which is often strengthening the rotator cuff.
By the way, I'm thrilled that my fitness center is back open and working out again because I was reduced as well, Dr. Coles. I know you've got a gym in your own home. We're not always fortunate, so wear your mask, be smart, listen to the doctors, but it's great that hopefully we're on the comeback, right?
Absolutely, Steve.
Have a great week, Dr. Cole. We're out of time, and stay healthy, my friend.
Likewise. Talk to you next weekend. See you then.
Many thanks to our producer, Shane Reardon, also to David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Kashul. We say so long, and thank you for listening to Sports Medicine Weekly. We're back next week at 8 a.m. Central with a brand new edition of Sports Medicine Weekly, only on
670 The Score.